4 days in, I can already see the dorsal hump is completely gone. My septum, as far as I can tell, has been completely straightened. My nasal tip has been raised, and it looks like it is quite symmetrical as well. Coming in, I was already confident in the skills of Dr. Vikas Gowri, and he has definitely delivered. I'm shocked that these are the results after just 4 days.
Wow. Giving you a beautiful nose is my passion because I am doing septorhinoplasty for more than 15 years. So I am a board certified aesthetic plastic surgeon. I am based in Kaira Aesthetic Clinics in Ludhiana. So today I want to highlight a very common case of rhinoplasty, as you can see in the picture. So a beautiful face, but the nose is deviated. So you can see the nose is not straight, the nose is totally deviated. So why there is a nasal deviation? Because the septum inside, that is the cartilage, is deviated. So we have to do the septoplasty. This is called the DNS, deviated nasal septum. So this can be the cause of the external appearance as a deviation, or there can be internal breathing problem. So this both can be corrected by the septoplasty. Second, again a very common in my practice is the dorsal hump. Dorsal hump means there is the height of the nose, that is the bone and the cartilage is more. So we have to reduce the height. And the third is the nasal tip. The nasal tip is drooping down. So we have to use a part of the cartilage, we have to put it in the nasal tip as a columella strut to lift the nasal tip permanently. So you can see there was a hump here. So we have reduced the hump and we have lifted the nasal tip. It was very droopy, and the most important was the nasal deviation. So correcting the nasal deviation with the septoplasty is a challenge. You can see a perfect straight nose. Perfect. Good. So you see, this is why we are getting results at 4 days, because we do preservation rhinoplasty and we have got the piezotome for the bone, and we have got very experienced hands. So otherwise, if you see any patient after 4 days, there is a lot of swelling. Earlier we used to get a lot of swelling and there is a bruising, but this is the perfect result at 4 days. So you can appreciate the result at just 4 days. So this is to be highlighted. This is a very good result at just 4 days, because at 4 days many people they are in the impression that there will be a lot of swelling. Though we do all the techniques same as the rhinoplasty, because of the advancement or the skills or expertise, so we are getting very less swelling for last few years. So you can see, appreciate a totally straight nose. So you can see the shine on the nose. So it is a straight nose at just 4 days. The nasal deviation has been corrected, and the breathing has also improved. So in this picture you can see the dorsal hump is gone and nasal tip is lifted. So still there is a swelling at the nasal tip which will improve over next few months, but it is very easily appreciated that the dorsal hump, that is the bone and the cartilage, has been chiseled and rasped nicely to give you a very good profile. Before there was a significant dorsal hump, and the nasal tip has been lifted due to the nasal tip modification techniques, and we have modified the lower end of the septum also. Thank you.